Hello. Welcome back. If you haven't been here before, welcome for the first time. I am Jenny. I talk about random things that pop into my mind. You are welcome to make comments in the comment section below, but just please remember to keep them nice. Be nice to each other. You do not have to agree with me, but we do have to be nice to each other. And so today I'm going to talk about something that I haven't talked about in a long time because that's just how it works out for me. So about a year ago, I posted a video about lung cancer screening and how your insurance covers it if you're a smoker and you meet certain criteria, or if you're a former smoker within that criteria. And it was kind of scary for me. I have a nodule in my lower right lung. There's three lobes in your right lung and two in the left, and I have a nodule in the very bottom right lung, right next to my diaphragm. It's in a bad spot. And anyway, so I got my lung cancer screening. It was pretty big. It's about the size of, say, like a pea. Just, big enough for them to be concerned. All last year I went through a couple CAT scans, a PET scan, and the conclusion that my doctor came to was watchful waiting. So in the fall I had my last CT scan and he told me to wait 6 months, which, let me tell you, is nerve-wracking. It is nerve-wracking. But I had one done earlier last week and went to the doctor yesterday, and there has been no change, and the reading says that it's probably benign and I don't have to do it again for a year. And so I think I'm one of the lucky ones, because a lot of times, these videos on here are people who are saying, well, I've just been diagnosed with cancer, and that's horrible. And they thankfully, for some of us, they do give us their story about what they're going through and what to expect. But I want to put mine out there as a positive to let you know that if you have a history of smoking, don't be afraid to go get that lung cancer screening. The CT scan itself is not hard. It doesn't hurt. They might put a dye in you, and so that's like through an IV. There's whatever little pain with that, but it's not like having a surgery. And in my case, I if you go back and look at some of my other videos, I had quit smoking. I am still vaping. Yes, my doctor wants me to quit vaping. Yes, I know I'm putting something else in my body, but I can feel a difference between the smoking and the vaping, and it's baby steps. And I can't tell anybody how to live their life, but what I do want to tell you, we all know that smoking's bad. There's no sense in me even telling you to quit smoking because you know it. But if you take that step, be brave, go ahead and take that step just to get the screening done, it might be enough just to help you think about some of your choices that you've made and your lifestyle that you're living, to make some healthier choices. I know I'm working on it every single day. I'm still a little chubby. I haven't mastered it yet. I'm not even going to claim to be an expert. I'm not. What I am an expert in is in my life, just like you're an expert in your life. And I'm sharing this with you to help you not be afraid, and that not have this fatalist attitude. I think a lot of people who smoke and then they start developing symptoms and they feel like they deserve whatever it is that happens. And yes, there are consequences to our behaviors, but you always have the opportunity to start over again and try to do better the next day, no matter what it is. But in this particular case, you can start over, and maybe it's not as bad as you think it is. Just take a chance and find out. And if it does come out to be a positive cancer, the sooner you catch it, the better your chances are of surviving. So please, and more than anything, for those of you who have been following me, I want to thank you. People have been asking me, because there was this time period where I wasn't posting anything because there wasn't anything to post regarding this topic, and still asking me how I'm doing or what's going on. And that is not gone unnoticed. So there are people who care about you. If strangers on the internet care enough to ask me, I am so sorry about this. Strangers on the internet care enough to ask me, somebody cares enough to ask you, okay, how you're doing. And I can't thank you enough. And so at this point, I'm probably not going to talk about it anymore unless something else comes up. But I'm doing pretty good. I'm doing pretty good, and I'm grateful. And I just hope that my story, as short and really kind of, non-dramatic as it is helpful to somebody else. You don't need to worry. Go ahead and get the test done and find out what's going on with your body.